Our next presenter is Dr. Matthew Wilmot, and he is a Midwest AIDS Training and Education Center Community Health Educator at OSU's Medical Wexner Center. His presentation is entitled History of Ohio HIV and AIDS Activism. Dr. Wilmot, whenever you're ready, feel free to start.
Thank you, Rhea. Listening to the presentation by Dr. Jesse and Thomas, it's a hard act to follow. And a lot of what they've said is probably going to be covered in this presentation, but I hope to provide some new information as well to help stimulate more conversations about this topic. So I'm going to share my screen real quick. Bear with me for a second. I'm actually not using my computer today. I'm using a different computer, so you can just imagine how fun that is. Okay, can everyone see the presentation?
Yep, you're good to go.
Yep.
Awesome. Okay, so for today's presentation, I will be talking about Ohio HIV/AIDS activism, which has a unique history to it, given that what we know about HIV/AIDS and specifically the structures that we've put in place within Ohio came from a lot of the groundwork that was done in the early days when the cases, when we began to realize that an epidemic was at hand. Just a little bit about me. As was mentioned, I'm a Maytech OSU community health educator. I present topics on HIV, structural racism, LGBTQ-isms, and more recently, COVID-19. I am from Canada. Not much to talk about that. As well as on my spare time, I'm an amateur mixologist and I practice Swahili. So in creating this presentation, I thought of ways in which to kind of approach the topic of HIV/AIDS activism. And one of the ways I thought about providing a background into the history of it was through the lens of a time capsule. And the reason why a time capsule became a fitting way to depict it is because time capsules typically provide us with meaning and structure to to a narrative that we create or that is created for us through a particular period in time. And in this presentation, there'll be fewer words and more images to give us a context of the atmosphere that we lived in at that time. And that it's my hope that it'll be less of my words that will convince you of how different our knowledge of HIV and AIDS was back then, and how the activism we took to call attention to it was a matter of life and death. And so you'll see images. There'll be a couple of videos and some text to convey this information, and it will help us to get a sense of where our activism really took off and how it shaped, in many senses, our understanding of sex ed, and sexual health today. To get a little bit of audience participation, I want you to indicate in the chat how old you were when this headline came out. I know we have a lot of students here, so I know that there may be some who weren't born during that time. I was not born during that time, but at this point, doctors at hospitals in New York, California, we're seeing a rise in cases of a rare cancer that was at the time specifically affecting gay men. And even though the headline says a rare cancer seen in 41 homosexuals, we know now that this was a term that is pretty outdated, this designation, given that this was only a few years out from having removed the term homosexual from the Diagnostic and Statistical Manual. And so as doctors began to see these men who were, many of whom were young and had, at a point in time, thriving health, were suddenly dying from cancers um, and other ailments that were commonly seen in people who had failing immune systems. Many of the men diagnosed had reported multiple and frequent sexual partners within the past year. And so that's led to, at the time, many proposed names for this disease. And as you can see through some of the names, for those who were alive during that era, these were some of the names that were thrown out there for the disease, because at the time this had not been at least reported at this level in heterosexual identifying persons. Nowadays, we are aware that men may have sex with either each other and not identify with labels as gay or same-gender loving. But at the time, we were not aware of this. Okay. So, the early 80s. So, little known fact about activism is that its ability to shape outcomes is dependent in part on the relationship people have with those who are most affected by the cause. And at the time where AIDS cases began to rise, many of the public, particularly within the gay community, were seeing this as a disease that was endemic to white gay men. And so activism began to shift towards spreading awareness within the gay community. However, it was noted that there were gay men who were not white who were also part of the first cohort of AIDS cases. But in keeping with kind of the creation of this narrative, having this from the early part of the 1980s, with the narrative that this disease was part of the white gay community. This helped to provide a larger outreach of activism to provide an understanding of what was causing these cases, and eventually, the cases, the terminology to designate this disease changed from what was known as gay cancer to acquired immunodeficiency syndrome. Eventually, 2 years later, we see that the identification of the human immunodeficiency virus helped to pinpoint that this was not a disease that could be acquired through means such as, as have now been debunked through, touching a food that was or tools that were used by someone who identifies as gay, but that this could be transmitted sexually, as well as from mother to infant, as well, and through intravenous drug use. As activism began to increase to further solicit government help to address this epidemic, what we see then is the cases within African American communities begins to rise. And one of the elements that we see that affects this change in the narrative is the confluence of different other factors that affect the opportunity to have one's activism received and attended to by the larger public. In Ohio, the first AIDS cases were reported in 1983. And with the help of AIDS activists from other states, Ohioans across the 3 major cities began to organize AIDS education seminars, plan demonstrations, and provide support for those who were neglected by family and former friends because of their new diagnosis. One of the first formal organizations to tackle the AIDS epidemic in Ohio is the AIDS Task Force of Greater Cleveland. Many folks who, during the early 80s, who were diagnosed with AIDS were essentially given a death sentence because at the time it was learned that that AIDS was the final stage in which your immune system is unable to fight off even the most what are seen as the most innocuous of diseases. And we know that that is not the case now with the advent of treatment that addresses and can lead to immune system rebound. As noted in the slides, the AIDS Task Force of Greater Cleveland was created as a non-medical hospice for many who had been thrown out of their homes and were estranged from family and friends, and was providing and served as a way to provide the support and social structure to help those who were dying to die with dignity. Okay. Another organization that some on the call will be familiar with is the AIDS Resource Center, or ARC Ohio, and which was created in 1984. Which by then there had been HIV had been confirmed to be the cause of AIDS, and with that, allowed for individuals in the community to provide that education to not only debunk some of the myths that had been around regarding HIV, but also to provide an awareness that the activism that was taken within to address this epidemic was based on the groundbreaking science that was taking place. At the time, unfortunately, there had not been an FDA-approved test for HIV, but that didn't prevent activists from AIDS Resource Center, Ohio, from continuing their work to educate the public. And whether this came in the form of providing support for those dying, to debunking the myths about AIDS, and training an increasing number of volunteers, ARC Ohio was able to take the mantle from many of the out-of-state activists who had come to continue the expansion of awareness of this growing epidemic, and provide a continued and sustained movement to address the health of those living with AIDS. The Columbus AIDS Task Force is another activist-driven organization that was established shortly after AIDS cases were confirmed in Columbus. And once an HIV test was approved in 1985, activism began to branch out to provide access to those most in need. And this could come in the form of providing access to HIV testing, which was much needed during that time. Little known fact, when the first approved HIV tests were made available, it took about 2 weeks to get your result, and now you can get your result within half an hour, which really shows how much of a disparity there, or at least how much progress we've made in the areas of testing. The formation of the Columbus AIDS Task Force was essential for providing that support for those living with HIV/AIDS, and providing the counseling to help folks learn about the ways in which they could reduce their risk of contracting the virus. Additionally, their awareness spread through fundraising, through events such as Art for Life, which continues to this day, and allows for folks to contribute in a way that to contribute to the fight against AIDS in the Columbus community, by providing various ways in providing art to help with the cause. Similarly, in Cincinnati, Caracol was established in the later 80s to address the emergence of HIV/AIDS in Cincinnati, and continues to this day. So by 1987, it became increasingly known to the public that there was an epidemic at hand, and that many of the communities that were marginalized and at that time were taking a concerted stance to educate the public that health needs of those living with HIV/AIDS could not be ignored. And this this allows us to see where at a point in the story, the contents of the contents of this story take on a more symbolic form, and that could be that could no that could no better be depicted through the AIDS quilt, which is why we've gathered today. In 1987, the AIDS epidemic and the activism was to a large degree still confined to many in the LGBTQ population, and this and as a result of the stigma that was still and still is around regarding people from the about people from the LGBTQ community, um, the federal government took what we now see as a slow and insufficient effort to address the crisis. Deaths from AIDS had recently reached about the 10,000 year mark, 10,000 per year mark, and the nation was beginning to recognize its impact. At this time, celebrities such as Sylvester Jr., Rock Hudson, and Max Robinson had succumbed to the AIDS illness, and it then became more apparent that this was not going to just affect people within the LGBT community, that this was going to affect everyone. At the time, there were only 1,920 panels. Today, there are 48,000. In order to bring more attention to the humanity of HIV/AIDS in America, it became apparent that depicting the suffering not only borne by those who are living and who are dying of AIDS, but also the impact it had on their family members, was needed. And when Time magazine published the picture of David Kirby lying on his deathbed at the Pater Noster House in Columbus, Ohio, it really sent shockwaves across the nation and to the world that someone this young was in this state. And it by providing this humanization of a crisis, it really took that picture and many others to show how important how important the public's response and the public solicitation of government response was to battling and hope and getting a firm grasp on the epidemic. However, we see that at this time, the number of new AIDS cases and new HIV cases in African Americans had now surpassed that of their white counterparts, and this rise in cases we can attribute now to a lot of the absence of attention and support that was given to predominantly African American areas. Additionally, the underrepresentation of in leadership in AIDS organizations, as well as some of the homophobia that was expressed in the Black community. And I want to stop there because I want to also call attention that we look at organizations such as like the Black churches, and even though there were many within Black churches and Black organizations who displayed homophobia during this time, there were others that had taken a concerted approach to help spread awareness within the community as well as at a larger stage.
Dr. Wilmot,
Yep.
Friendly reminder, you have about 5 minutes left.
Okay, my apologies. For example, someone like Reggie Williams was instrumental to calling attention to the effect of AIDS in the Black community. I do apologize for taking so long. So I'm gonna have to I do have to rush through some of this now. And as you can see further along through the 90s, that this really became the narrative began changed to African Americans being the uh, uh, having more cases than having more newly diagnosed cases than other racial groups. And to kind of summarize much of this, it was apparent that access to treatment, that once treatment was available, access to it became the new the new topic of exploration within activist circles. And so through the advent of programs such as the 340 drug discount program, this allowed for AIDS service organizations to partner with state governments to ensure that drug manufacturers created programs that allowed patients to receive HIV medication at a low cost. Furthermore, as research began to allow for additional methods through which people could prevent the spread of HIV, this continued effort to ensure that costs were affordable and that education was sustained to address stigma-related concerns. We see that that activism continued to evolve in this manner to allow for us to really hope that the epidemic would end. And I think now the cases, one of the main issues is the fighting the criminalization of HIV, which I know was addressed earlier. And so the Ohio modernization movement has been really key and instrumental in calling attention to many of these laws that were passed during the 80s and 90s as based on a hysteria of the effect of HIV at that time. And so just to see here some of the current laws that are on the books are not allowing for folks to living with HIV to live a life that is without fear and without stigma. And so it is allowed, and so in addition to allowing for folks living with HIV to be given comprehensive care, many of our organizations from the early 80s have banded together to provide supportive services and linkage to care to individuals living with HIV. And so the message of activism has now has evolved in some ways, but has also still called attention to certain areas in which our leaders in government need to address. And those are things like the disparities. I know that was mentioned in terms of the rates of HIV within communities of color, and particularly trans communities of color. And so I think when we're looking back at the HIV AIDS crisis of the past and where it's led us to now, I think one of the things we need to continue to address and keep in mind is how we can create an environment that allows people living with HIV to live well, but also to rectify some of the injustices that were enacted during the early days and that continue to be enacted today. That is the end of my presentation. I welcome any questions. And I do apologize for that rush through that.
Thank you, Dr. Wilmot. That was an excellent presentation.